Hi, welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. Today's topic is thinking outside the mask. It's pretty clear that we are going to be wearing masks for the foreseeable future. We learn more and more about this virus every week, and we understand how it's transmitted by respiratory droplets. The best ways to protect ourselves and each other is by wearing masks and by keeping social distance. We've been very fortunate the past several months that the weather's been beautiful and we've been able to be outside and keeping social distance from one another. We've been able to visit with friends and with relatives and with neighbors and be protected and to protect them. Hopefully, we've got a couple more months of that kind of weather. Masks will be with us until we have a reliable, effective, safe vaccine. So what does that have to do with skin? Well, this is what we look like with masks. People don't see the majority of our faces, so we have two focuses. One is to keep the skin under the mask healthy. I already did a video about that because a number of people had asked me to talk about maskne, or the acne and bumps that develop under the mask. I talked a lot about that, but I also focused a lot on how to simply keep the skin under the mask healthy. The other focus is the aesthetics of the skin above the mask. I say all the time that when it comes to the face, nothing is as attractive as healthy skin. So the first thing we have to consider is how to make sure that that skin is healthy. Well, first, is there acne there? There are lots of different types of acne. And if you're struggling with acne, give us a call and let's have a consultation. But a quick rundown. If the acne is right along the hairline, lots of times that has to do with hair care products. And if you're like a lot of people, you've been switching around products during this pandemic, go back to the product that wasn't giving you acne there. Next, if you have acne that cycles with your cycle, it's probably hormonal. We can help you with that as well. A lot of times people complain about pores. Enlarged pores frequent the T-zone. Here, here, and here. First, cleanse your face every night. Don't let the makeup and the day products and just the general grime that collects on the face stay in the pores overnight. They hold the pores open and stretch them. Cleanse your face at night. Then, if pores are an issue for you, you should be using a retinoid. Retinoids will get rid of the natural skin plugs that hold the pores open, and they increase cell turnover, which is an important part of shrinking pores. Next, a lot of times people complain about brown spots on their foreheads. Easy treatment, but the number one complaint in this area are creases, frown lines, horizontal forehead creases, and crow's feet. These are creases that happen because of repetitive motion. So our skin is attached to muscles. When we were 10, when the muscle underneath contracted, the skin contracted and made a little what's called active crease. It's called an active crease because the muscle underneath is actively contracting. But as soon as it stopped contracting, we were 10. The muscle relaxed, the skin fully relaxed because we had normal collagen and elastin at that point, and the skin was really smooth. But as the decades go on, we lose collagen and elastin from aging. And collagen is what gives skin its thickness, elastin is what gives skin its spring back, and that natural aging is accelerated by sun damage and toxins in the air and chemicals in our food and stress, smoking, excessive drinking. And so there comes a time when the muscle underneath contracts, the skin contracts and makes that active crease. And when the muscle relaxes, the skin doesn't fully relax and it leaves an active crease that now becomes a passive crease. And so it's a permanent crease. And that's often a point at which someone comes in and says, my skin looks older than I feel. I have a permanent frown line that makes me look cross, or older than I am, or older than I feel, or I have permanent ridges across my forehead and my makeup gets caught in that, or I have creases all along my eyes that make me look like my mother or my grandmother. Well, in our 30s and our 40s, we are younger now than our parents were. And in our 50s and 60s, we are younger than our grandparents were for a number of reasons. We exercise more. By and large, we eat better, and we wear younger clothes, we listen to younger music, and we have the opportunity to do things that make us look younger. We have younger hairstyles, we color our hair, and we want to continue to look as youthful on the outside as we feel on the inside. And that extends to our skin. So when we start having these permanent creases, we don't like it. And it's actually pretty easy to treat. But there is not a cream we can put on the skin that's going to get down to the muscle for these passive creases, because the muscle is the bad actor. Remember, it's the repetitive motion of that that's causing these passive creases. What we do have are injections. In this country, we have 3. In order to understand them, you have to understand a little bit about how muscle contraction works. So here in the frown, say, here's a muscle fiber. It's not the whole muscle, the whole muscle itself. It's just one muscle fiber. And when your brain wants this muscle fiber to contract, it sends a message to this nerve, and this nerve releases acetylcholine, which is just a chemical, and that chemical makes this muscle fiber contract. All of these injections, the 3 in this country and the many in the rest of the world, temporarily stop the release of acetylcholine. But it's temporary. About 28 days after the injection, some acetylcholine gets by that plaque, and by 4 months, all of the acetylcholine gets by the plaque. So if you hate the injection, which most people don't, 4 months afterwards, there's no local evidence that it was even there. If you love the injection, which most people do, at 3 months, that one muscle fiber has about 2/3 to 3/4 of its movement back, and that's a great time to re-inject and stop that movement. And then 3 months later, it has 2/3 to 3/4 of its movement back, and it's a great time to re-inject, and so forth and so on. If you're really good about getting those every 3-month injections, 2 years after that first injection, you've gone 2 years whereby that muscle fiber has not done that last 1/4 to 1/3 of its movement, and you've functionally started to retrain that muscle fiber. It has lost muscle memory of that last 1/4 to 1/3 of its movement, whereby for most people, now this isn't a guarantee, but for most people at the end of those 2 years, they can space out the interval between those injections and have the effect last longer. So most people can space out to 3¼ months or 3½ months, and for some people, maybe even a little longer, and have the effect last longer. But if during those 2 years you let it go all the way down to baseline, now you have to start all over again. So that's why the 3-month recommendation. So what are the differences between the 3 injectables, Botox, Dysport, and Xeomin? Well, the base is botulinum toxin. Stop. I know that name used to be very scary for you, but knowledge is power. Now you know exactly how it works. It blocks the release of acetylcholine. So it's no longer scary now that you know how it works. The botulinum toxin molecule is 150 kilodaltons. Botox was made in the 70s, and it was made for people who had blepharospasm, little twitches in their eyes, or crossed eyes. And as they gave it to people who were older and older, they started to notice that on the side where they gave it, the crow's feet went away and they thought, look at this, there's a cosmetic use for this. So the company developed a cosmetic unit, and they presented it to the FDA, and then the FDA approved it for use here in the frowns, and then almost a decade later they approved it in the forehead lines, and only really recently did they approve it in the crow's feet. But we've been injecting it in all of those areas and other areas all along once it was approved for cosmetic use. The thing about things that were created in the 70s is that they didn't understand proteins. Yes, the botulinum toxin is a protein. You can't get around that. And remember, I said it's 150 kilodaltons. The Botox molecule is 900 kilodaltons. It weighs 6 times as much as the botulinum toxin itself. So it's got a lot of additional stuff. It's got a big protein preservative, and it has all sorts of accessory proteins which don't do anything. And why is that? Because people didn't understand proteins then. They threw proteins into everything. Well, by the time they made Dysport, we had started to understand that proteins are actually biologically important when it comes to the body. Our body sees proteins as foreign, and it develops antibodies against them. We are bombarded every day with protein antigens. We see things with proteins as foreign, and so by developing those antibodies against them, the more and more antigens we see in the day, the more proteins we develop. And so the people who made Dysport decided to not have the accessory proteins in the Dysport. However, if you measure the molecule in the Dysport, it's different from bottle to bottle to bottle. And I'm a hard scientist. That bothers me a lot, that they can't be consistent from bottle to bottle and from batch to batch. That inconsistency worries me, and so I don't inject Dysport. And then when it came time for Xeomin, they decided to do away with all the excess proteins altogether. There's no preservative, and there are no accessory proteins. The molecular weight of Xeomin is 150 kilodaltons, exactly the molecular weight of the toxin itself. So it's very, very pure. Why is that important? Because you are very unlikely to develop antibodies to excess proteins if there are no excess proteins. We have a lot more autoimmune diseases now than we did 2 generations ago. We have people developing asthma at much earlier ages and much more severely. And if you ask allergists why that is, they'll tell you it's because of how many antigens we see. So when Xeomin first came out, it was what I offered to people who had type 1 diabetes, or MS, or irritable bowel syndrome, or ulcerative colitis, or asthma, or Hashimoto's thyroiditis, or Graves' disease, because those were autoimmune diseases. But over time, the more I learned about all this, the more I felt like everyone needed to have that information. If you are eating well, if you are careful about what cleaning products you use, this is one more little thing, and little things add up to big things. But that's only one piece of the puzzle. They also behave a little differently. It's much more easy to get a frozen look from Botox than it is from Xeomin. So it's really important to hear from someone, what effect do you want? Now, if you do side-by-side, they've done these side-by-side studies where they took people who have never had any neuromodulator, which is what this whole family of medications is called, and they injected them. And neither the patients nor the injectors knew what they were being given. And then the patients graded the effect, how they liked the effect, and they graded how long it lasted. And the injectors, who also didn't know what was being injected, graded the effect and graded the duration. And they lasted the exact same amount of time. Now, in fact, the Xeomin lasted a couple days longer, was not significantly different. So you have to compare apples to apples and oranges to oranges, not apples to oranges. If you're used to being frozen, and then you get injected with something that leaves you with movement, you're going to think you're not getting as good an effect and that it's not lasting as long. You have to be counseled. I think it's that simple. So what do the injections feel like? Well, in our practice, I'm the only one who does injections. And we put ice on the skin to help numb it and to help shrink the vessels. And I use the smallest needle you can possibly get in the United States. And I think that combination really makes them very comfortable. There are people who are needle phobic, and so we help try to calm them down. But I think really, in terms of comfort, this is not an uncomfortable injection. And what's it like afterwards? Well, they behave a little differently. Xeomin gives you a sense of tightness. It's not a skin tightening procedure, but that's the perception. And you usually start to feel that within 24 hours, and then it builds for 7 days afterwards. The company says 7 to 10 days, so I do say that to patients, 7 to 10 days, but most patients say it's within 7 days. Botox gives you a heavy feeling. And although some patients have that heavy feeling before 3 days, on average it's about 3 days that you start feeling that heavy sensation. And then that heavy sensation builds from 7 to 10 days after that. So it is usually 10 days, but it can be as long as 14 days after the injection. But both will soften or eliminate the movement of the muscles, and then they treat the passive creases, and they prevent the creases from getting worse. So if you're using Botox or Xeomin, those creases will never develop into things that can hold a nickel or that you can plant corn in. And in most cases, if you're consistent with it, they will go away. So it's both a prevention and a treatment. And it's something that will really make the area outside of the mask look younger, more healthy, and refreshed. I hope this helped. If you have any questions, please comment in the area below. I always respond to the questions in the comments. And as I always say, I really like that engagement. And I'll see you next week.